I know. Well, good afternoon, everybody. Good to see everybody again. Um, let's go through some data, a couple announcements, then take some questions. Unfortunately, we lost a member of the community. She was 65 years old, so certainly want to think about her and her family and everybody we've lost to the pandemic. Now 691 people directly related to COVID-19. Positive rate 1%, 7-day average, 14-day average 0.9. Slight uptick. 92 new cases today. Uh, well reported, about 44 cases out of Syracuse. That's in this number. So that's what drove the number. So certainly we'll keep an eye on that. Next week we get to vaccinate the students in masses. Some students have gotten vaccinated if they have comorbidities, or if they work at ride sharing or restaurants, but certainly we'll be able to get into the dorms, which are congregate settings, which are perfect places for COVID. So more to come on that, but we'll be vaccinating at our college campuses right when we can get out there. Active cases, 522. Out of today's numbers, 79% of the cases are under 40. I believe the number gets under 50, 89% of the cases. So the communities that have been vaccinated, if you look at the age brackets that have essentially participated heavily, are doing well. We're not seeing a lot of cases out of those demographics, so that's good. Hospital down a little bit. 31 individuals are in the hospital, and we have 6 individuals in the ICU. So please keep them in your thoughts and prayers. Vaccination-wise, we'll go over 170,000 county residents today. That's over 37% of the total population, and that was about 47% of the adult population. That's really good. I think after we get a couple more weeks in where we can get to these younger demographics, we'll get very close to where we need with our adult populations to be, around 70%, 80%. Remember, there's some natural immunity in the community as well with people who've had COVID. We've had over 33,000 confirmed cases of COVID. We know that that number is much higher based off the science. Again, Tuesday, April 6th, anyone who is 16 and over can get the Pfizer vaccine. We've mentioned before, we'll work with colleges and congregate settings first, as well as opening up clinics to the public. But then we'll eventually work directly with high schools about getting their juniors and seniors vaccinated as well. And then remember, the Moderna and Johnson & Johnson, it's 18 and above. So if you're 16 or 17, you need to, whether you're looking at our clinic or the fairgrounds, you need to make sure that they have Pfizer for that. First dose clinics will be Monday and Tuesday next week. New appointments are available. Go to the website and register. Again, Tuesday is April 6th, so if you are between 16 and 30, you can register for that. And then we will be doing a vaccine registration phone bank for blind and visually impaired residents on Tuesday, April 6th. We're going to have our phone bank activated, and so that folks can call in, and then we will schedule appointments. Mind you, on the first day, we never know what kind of call volume we get. So we get call volume. If we get a lot of it, we'll staff up the next days for that. But the hours of the phone bank will be 12 to 4 on Tuesday. The number that you call is 315-679-4099. And again, our workers will assist these members of the community in getting appointments to get their vaccination. Just a reminder on testing, please. We see where most of the cases are coming from. It's not a surprise. It's not a surprise when you have events and gatherings that 10 days later you're going to see a little uptick in cases either. We've seen that throughout the pandemic. But what we really do need to make sure is that symptomatic spread, those are kind of unforced errors. If we have symptoms of COVID and we're going out and about in the community, we need to avoid that, right? So Monday through Friday, the FSHED, you can go to ongov.net/Cougar Medical and get an appointment. Asymptomatic testing at our community sites. Today we're at Onondaga Town Hall in Shove Park. Tomorrow we will be at the Town of Clay Senior Center. You can go to ongov.net to register for that. Just a clarification, in my inbox I've gotten a lot of questions related to guidance related to some of our music in K through 12. The health department updated the guidance saying we're comfortable going with the CDC guidance or the state guidance. CDC allows you to be 6 feet, you are 12 feet, so you can go 6 feet. That's the district's decision. So just for the community, though, we did update that. I know that there's been questions and suggestions that we have not. Last night we had the state of the county. We put forward our vision for the year. We're going to have a busy two years here executing on numerous projects to help our people heal, but also rebuild this community and the economy. We also talked about our fiscal picture and how it's clearer. And one of the things that we did when we were losing revenue quickly, and there were so many unknowns, is that we enacted a COVID energy surcharge. It was always a temporary surcharge that would sunset in 2022. I spoke to Chairman Knapp and Majority Leader Brian May, and we're going to move forward legislation over to the legislature to have that surcharge expire sooner. We don't know exactly what the date will be. The legislature will debate it, take it up in May, but then it goes to the New York State Tax and Finance, and then the utility needs a little bit of time to stop collecting the surcharge. But our revenue picture is clear. We no longer feel that we need to collect this surcharge, so we are going to end it earlier. Saying that, happy to take questions.
What is your advice heading into Easter weekend, in regards to gathering?
Yeah, I think right now we'll have, going into the weekend, 170,000 people have been vaccinated. That still doesn't give you need to be smart, right? And especially if people haven't been vaccinated, obviously larger gatherings probably not the best idea, recognizing that people are going to celebrate. And so let's just be practical, let's be smart. I don't know what the weather's going to look like, but nice weather outdoors, always better than bad weather indoors. So, but right now, if you look at it, Amanda, I mean, we know where it's happening. It's happening in the communities that haven't been vaccinated. So hopefully this will start to change over the next 2-3 weeks once we get these kids and our young adults vaccinated. We'll start to see these numbers, which have been relatively stable, right, between 40 to, I'd say, 70 cases a day for most days. A couple days we've had 90. Usually when you have a case day like that, you look for an explanation. We understand what happened, right? So we're not really too worried about 1 or 2 high case days a week if we understand why. But again, we know this virus does well in indoor settings, and we know it does well in gatherings of people. If you're not feeling well, you need to probably stay home and get a test. And if folks haven't been vaccinated, there's more risk with those gatherings.
Ryan, are you making arrangements to go up to the SU dorms next week and start vaccinating? And if so, how much supply are you dedicating to that?
Yeah, we're talking about probably redirecting some supply to some of the dorms for potentially Tuesday, Tim. Still a couple logistics issues there. One of the issues being we'll find out this weekend how much vaccine we get for next week. So that will impact what we're going to do. Syracuse University has their own nurses, so they have the ability to vaccinate. So they're kind of in a different boat than some of our other colleges and universities. We are looking at schedules on college and universities, so some schools are in session longer than others, so that will determine potentially what type of vaccine you want to give. If you're hitting up against a 4-week wall, then you probably aren't going to do Moderna because the second dose is Pfizer's 3 weeks. Depending on what happens with the J&J supply, I don't know if what happened in Baltimore is going to impact next week or not. We're supposed to get more supply of that. So there's a couple variables here, but the cases in the community are in congregate settings that haven't been vaccinated. That happens to be dorms.
Does Syracuse University or other schools, will they get their own supply direct from the state or federal government?
We don't know. We don't know that. It would be nice, but
Do they not know that also?
they don't know that. Yeah. Yeah, they've been allowed to be a vaccination site at Syracuse University. That doesn't mean they'll get supply. That means we would probably direct supply to them.
And we know, you mentioned the high cases at Syracuse University, the high quarantine numbers, and we've talked previously about your desire to vaccinate this community, that specific population. 16 and older is a go next week. Is that the focus now, making sure, is that the key to solving this constantly trickling up case number at you?
Yeah, it's congregate settings, right? We saw what it did in nursing homes. We've seen what it did to assisted living facilities. If you get an apartment complex that has similar living conditions, it happens, right? So it's just the rationale behind the process with the vaccine has been you vaccinate those who are most vulnerable to hospitalizations first. And we've done that now. So the biggest risk now is these congregate settings. Young people just happen to be more active. That's who they are. And they've been going through this for 13 months. So I wish we could have vaccinated earlier. My position has been very public. Could it have had an impact? Probably. But now we'll get to business next week, and we'll start getting these kids and our 20-year-olds, adults, vaccinated, and then we'll work with high schools as well to vaccinate their juniors and seniors once mom and dad gives permission.
I don't know if there's been enough time since the age lowered to 30, but are you seeing appointments disappear more quickly now, and how much of a crush is there for slots?
Yeah, I think they're going. They're filling up. So it's not like we're struggling to get appointments right now, which is good. We shouldn't be, right? We should, at least for a week, we should have pretty good flow from that 30 to 40-year-old demographic. And so it should probably slow down a little bit next week from that demographic, and then we should be able to focus in on the new demographics. But again, we'll go over 170,000, probably be at 175, maybe even a little higher on Monday. And so you're approaching 50% of your adults right there before you get into, your 16. Just think about the college kids we have, and there's 20,000 college students at least, right, that are here. So I think we're going to get to our 70% number, and we'll probably, to get higher than there, we'll probably have to do some more work. We'll have to deal with hesitancy. We'll have to micro-target and make it really easy in zip codes that haven't had participation rates. But I think we're doing pretty well overall with participating.
You say 20,000 college students. They're not getting maybe their own supply. You'll have to reallocate some county. I mean, is it going to be a challenge to get you all 20,000?
Again, better if you have some more tools, right? If you have the Johnson & Johnson tool, you don't got to worry about the second shots. Again, we haven't seen, this is supposed to be the big week of more Johnson & Johnson supply in the state. I don't know what, maybe this week we get a lot, but then the next few weeks we don't. We asked for a lot of it, so hopefully we're going to be we've been getting between 6,000 and 8,000 doses a week. Hopefully we'll be over 10,000 next week. But I think overall, your doctor's offices are getting it. Pharmacies can vaccinate anybody. The fairgrounds has a site. So our pod, I envision our pod being more of the catch-all, be-all, going where the problems are, and dealing with that, and then micro-targeting with hesitancy, because these other demographics are going to be able to go to the pharmacy, they're going to be able to go to their doctors, and so we'll be surgical and opening up slots to the community at large, but also going and addressing these populations that we know the cases are flowing through.
Do you think you'll be the catch-all for SU, or are you going to go and be the prime vaccinator for them in the time, for the time being?
Logistically, when it comes to supply, that's what we're looking at, unless they get their own. And even if they get their own, we might give them more, right? So they can do more. They have nurses, so we won't have to supply as many nurses to them. Depending on how the clinic operates, do we have one of our people overseeing it? Maybe. Those are logistics issues that our health departments would need to work out.
In terms of hesitancy, what are you seeing demographically in that 40% of 47% of adults that have been vaccinated? Where are the soft spots?
Yeah, there's some suggestions early, right? That there might be ideological hesitancy a little bit. Those who maybe a little more conservative in their ideology. It's too early on zip codes. We know that there's traditional hesitancy within certain communities of color, and so, but we have other minority communities that have exceeded participation, Asian Americans. I think the real test, Tim, is when you have all the eligible residents, give them 2-3 weeks of time to get their shot, and then look where the data is, and then you really look at those zip codes. I think that will tell a different story. And some of it might be hesitancy, but some of it might be we just literally need to go there, and we just need to be in that zip code and activate more credible messengers. We're still doing pop-up clinics in accomplishing that, but I think you may see, once we get these positive or these participation rates closer to that 70%, that our strategy has to be different to keep making really strong inroads.
What is the current expiration date for the surcharge?
Currently, I think it's the third quarter of 2022.
So late in 2021?
Yeah.
Do you think it'll be as soon as expiring in 2021?
I would expect it to be in 2021, yeah.
When those conversations were happening, a lot of people noted that Onondaga County is one of the few communities that didn't have it.
Correct.
So why isn't it, if it's something that is just kind of expected elsewhere, why go back on it?
Well, Andrew, it's like you talked to some members of my staff today. To your point, it's a sales tax, right? And for some reason, we just haven't had it in Onondaga County. Other counties do. What we said to the public was that we needed this surcharge to happen because of the unknown and our ability to respond to the pandemic. Right now, some of the things that we were being told that would happen to us factored into that decision to even approve this, right? So when you're being told the state's going to cut you $20 million mid-year, and these types of things, and they're withholding aid, right? So it's not like they're just telling you they're going to do it. They're actually not making aid payments to us. You believe them, right? We believe you. You're telling us you're going to cut us 20%. Okay. So what are we going to do mid-year? The only thing we could do from revenue was this. So the legislature did a really nice job working through the process of figuring out how long will it take us to get through the pandemic and then some of the recovery, and how long would we need this revenue. So it went into 2021, obviously 2020, the end of the year, into 2021, and then into 2022. And if you think about it, if we had a $20 million cut from the state, this doesn't cover all of that, but it would give you time to get where you needed to get and manage yourself out of the crisis. So the state cut didn't happen at the rate we thought it was going to. Sales tax was trending when we were doing this at 20% loss year over year. It ended up being much less. We had a very strong Q4. So we made the commitment that this was essentially a temporary tax for what we hoped was a temporary problem, being the pandemic. And now our fiscal picture is clearer, so we're going to make this a much more temporary tax and have it sunset in 2021, not 22. And I want to thank the legislature for that, too.
Have you heard from anyone that didn't like it?
No, I think anytime people are paying a little bit extra more of something, if they don't have to pay it, they'll be happy about it. I haven't heard from any legislators that they're going to be opposed to it. I spoke to the leadership, and they're very supportive of trying to do something.
You said 44 cases at Syracuse University, right?
Yeah, I think that's what they reported yesterday, which shows up in our data today.
The CDC director recently said that vaccinated people can't transmit the virus. I'm sure that's good news as the county's working to vaccinate everyone. Right?
Oh, yeah. Yeah, no, that's very good news.
Brian, there was hesitancy, it seemed like, among some nursing home staff, was widely reported, not just here, that to the vaccine. Have you heard anything more about whether that's been overcome? Do we still have that?
No, yeah, I still think it's a little bit of a problem. With nursing homes, what happens now is when there's a new resident that goes in that hasn't been vaccinated, they contact us, and if any of their employees can contact us, and then the state gives us additional supply to then go either distribute to them directly to vaccinate. But Tim, I think you're right. I think there was pretty strong hesitancy, and I do know that there was a report we got a couple weeks ago that wasn't really right. They had to correct it, but that from the state that showed new residents in nursing homes that need to get vaccinated, and there were some staff members too that were on that list. So some people now are getting more comfortable, but I still think there's hesitancy there.
On a different note, your thoughts on the legalization of marijuana in the state?
Yeah, I try not to opine on whether or not I think it's a good idea. I think it's a really complicated idea. What we've said is, and this is true, and nobody really debates it, is that you're making a drug legal now, and people will now legally abuse the drug that weren't using it when it was illegal. And so one of the mandates of this is almost falls into our lap, being a local government, about if you think about addiction issues, you think about public safety protocols, issues this may have with kids. So there's positive things with the policy, and there's negative things with the policy, right? Criminalization of this drug over the years has not served communities well. At the same time, there needs to be an acknowledgement that just like alcohol, people will abuse this. And I don't think the legislation went far enough to support the people that will be doing the work on the front lines with folks who have addiction issues.
Brian, could you talk a little bit more about something you brought up last night at the State of the County, the kind of reconstituting of the Alliance
For economic inclusion.
Will that just be like re-impaneled, and how much money is available, and how will projects be selected?
Yeah, so the projects what we did, Tim, is we went back and surveyed the recipients of the awards in 2020 and confirmed with them that their project is still feasible, or it's an initiative they can still undertake. I do believe that there are some of the projects that were awarded that are no longer feasible. So what we'll do is we'll start to fund those that are ready to go, and then based off of the leftover allocations, we'll probably get the AEI has a board that reviews it. We'll probably have some sort of competitive process for the allocation that was lost because of projects that are no longer feasible.
Okay, so everything that's going at this point was previously approved.
Correct.
Originally in the URI, the Upstate Revitalization Initiative, there was $30 million
So there's, I think we're hugging up against the 30 with the 2 rounds. There has been some conversations with the Regional Economic Development Council about potentially another round of AEI, an AEI 3, but the state basically froze a lot of that spending during the pandemic. The Red Sea boards haven't been meeting as frequently on these types of initiatives, but I think you're starting to see some of these things loosened up. I think in the state's budget, there's going to be more money for regional economic development councils, and I think with things loosening up a little bit, the URI funding that was left over, I think will probably be allocated at for projects sooner than later. Other questions? Okay, thanks folks.